Siapa sih yang nggak doyan sama sate? Sate adalah makanan khas Indonesia yang mendunia bahkan menjadi buruan para turis. Tapi pernahkah kamu mendengar desas-desus seputar dampak mengonsumsi sate bagi kesehatan? Sejumlah masyarakat Indonesia percaya bahwa mengonsumsi sate yang agak gosong dapat meningkatkan risiko penyakit kanker. Apakah hal tersebut benar? Simak wawancara tim tkon.id bersama Dr. Grace Tan dan Dr. Melissa Theo seputar penyakit kanker perut berikut ini.
No, bloating is a very common thing, and I don't think that people get cancer just from being very bloated. And the first thing I would do is to check what kind of diet the patient is on. I had a patient who saw me the other day and says that they are very bloated, and we scoped, and the scope didn't show any problems. But later, when we were talking about what she ate at home, she loves to eat garlic, she loves to eat onions, she loves to eat spring onions. And she said every meal she eat one bowl of garlic. So I say you stop eating the garlic for a while and you come and tell me if you are better. And 1 week later she said no more bloating. So the diet is important. If you eat a lot of beans, green beans, kidney beans, red beans, you eat a lot of lentils, you eat a lot of cabbage, cauliflower, onions, spring onions, garlic, you can be bloated for a long time. The second possibility is also gallstones. People with gallstones can be bloated, especially after eating very oily meals. So if the scope doesn't show anything terrible, no gastritis, no problems in the stomach and colon, I would do an ultrasound of the gallbladder to see if there's any gallstones. Because if they have gallstones and they always get bloatedness after eating oily food, then the surgery that they will require is a removal of the gallbladder. So these are the common things. Of course, there will be patients who have what we call irritable bowel syndrome, and they are very sensitive to different types of food, and certain foods will cause a lot of bloating, and they will tell you that they are bloating for many years. I will tell these people to keep a food diary. Every day they write what they eat and they write whether they have bloating after that. Then they will, over the next 2 months, be able to identify food that doesn't cause them bloating and food that does cause them bloating, and they will avoid all these foods that cause them problems, and then we will observe. Sometimes we can give medication to relieve the bloatedness, but of course it is always important that we exclude serious conditions before we just say, you know, it's just bloating for no reason. But my suggestion is that if you have patients with this kind of symptoms and they cannot find an answer, then better fly down to Singapore and look for Dr. Tan or myself, because whether it is scopes that they need or gallbladder problem that they have, or unfortunately some of them will have cancer, we will deal with all of them.
Oke, jadi ada pertanyaan, pasien sering kembung-kembung dan sering buang angin. Apakah ini berbahaya dan kedepannya akan menjadi kanker? Prof. Melissa Theo menjelaskan bahwa kembung-kembung banyak angin itu biasa, jadi itu bukan hal yang berbahaya dan kedepannya juga nggak apa-apa. Dan sebabnya yang nomor satu itu adalah cara makan kita atau diet kita, pola makan kita itu bagaimana. Prof. Melissa Theo menjelaskan ada seorang pasien yang temui Prof. Melissa mengaku perutnya sering kembung-kembung dan dilakukan endoskopi dan hasilnya baik, ada apa-apa dan ada sesuatu yang membahayakan. Dan Prof. Melissa tanya gitu, kamu tuh sering makan apa sih? Hobimu tuh makan apa? Ya, beliau menjelaskan bahwa sering makan bawang bombay ya, spring onion yang bawang yang besar, dan katanya setiap makanan pasti makan satu yang ukurannya paling besar gitu ya. Pasti aja perutnya langsung kembung-kembung gitu. Dan juga kita harus perhatikan juga makan makanan lain yang sering membuat kembung seperti misalnya daun kol, ya kacang-kacangan. Jadi kalau memang kita perutnya sering kembung, ya kita kurangi untuk makanan-makanan yang membuat perut kembung. Yang kedua, Dr. Melissa menjelaskan kalau bukan yang itu, yang kedua yang Prof. Melissa jelaskan adalah melakukan USG, ultrasound, untuk mengecek apakah perutnya itu ada batu empedu. Ya, karena biasanya kalau ada kondisi seperti itu, batu empedunya mungkin ada iritasi atau ada harus yang dioperasi. Jadi pastikan aja batu empedunya nggak apa-apa. Dan yang ketiga juga memang harus ada beberapa pasien yang mengalami namanya IBS atau Irritable Bowel Syndrome. Jadi Prof. Melisa menyarankan pasien ini untuk melakukan namanya food diary. Jadi seperti diary kecil mencatat makanan-makanan apa yang kita makan tiap hari. Kalau makan ini kembung, catat oh ini kembung, makan itu nggak kembung, ya kita catat. Kita harus tahu makanan apa yang membuat kembung dan makanan apa yang nggak membuat kembung. Tapi kalau memang sudah dilakukan semua dan belum sembuh, Prof. Melisa menyarankan segera scan QR-nya, scan QR Dr. Kristan juga untuk berkonsultasi dengan Prof. Melisa dan Dr. Grace ya, bisa segera terbang ke Singapura dan konsultasi langsung ya, dicek langsung masalahnya itu apa, kalau sudah dilakukan ini semua dan belum.
So cancer is not contagious in the sense that you cannot pass it on from one person to the other in terms of, it's not like an infection. But we do know that cancer does run in families, and it's usually because of some genetic condition that can be passed down the generations. There are known genetic conditions, like in colorectal cancers, I mentioned FAP and HNPCC that have been studied extensively, and they have shown to be certain mutations in our DNA that result in it. And so there are tests that you can do to check for these mutations, and if it's detected in, for example, a patient with colorectal cancers, then we always recommend that their family members also get checked for this mutation. But I guess there are also a lot of patients who do not have these known conditions, but yet, they have when you ask them about their family history, they actually have a lot of family members who have a certain type of cancer, and that is probably something that is passed down the generations. And so in these people, we definitely should then consider screening, like I mentioned, to look out for these cancers at an early stage.
Okay, Dr. Chris, just now actually the patient was asking because she heard from a friend that the stomach cancer is contagious, meaning that maybe from my assumption, maybe the patient think of the helicobacteria because helicobacteria can infect. Is it true?
Yes. So I think that that's something that is interesting, but I don't think you cannot pass the cancer, but you can pass the infection. And Helicobacter pylori can be passed from, I guess, one person to the other if you share food and things like that. It's not that easy to pass it on, so it's not like if you have you share a food with your friend who has definite H. pylori, you will definitely get it. But there is a possibility that you can get it infections from one person.
Oke, jadi sobat saya rangkum ya. Ini ada pertanyaan, apakah kanker perut, atau kanker usus itu menular, dan apakah kanker ini bisa diturunkan ke anak-anak? Dijawab oleh Dr. Chris bahwa kanker usus itu tidak menular dan kanker itu tidak menular. Ya, jadi memang kanker itu ya cuma itu aja. Tapi harus digarisbawahi tadi ada penjelasan lebih lanjut tentang helicobacteria bahwa memang betul helicobacter itu bisa ditularkan. Ya, tapi cara nularnya juga nggak mudah. Ya mungkin cara penularannya adalah hanya dengan cara kita bertukar sendok atau sering share makanan sama teman-teman kita. Tapi penularannya juga tidak mudah sekali kok. Jadi ya bukan kankernya yang kita tularkan, tapi yang ditularkan adalah helicobacterinya, infeksinya. Tapi ya nggak mudah untuk ditularkan. Dan yang kedua adalah apakah ini penyakitnya menurun? Ya, penyakit ini menurun dengan beberapa keluarga yang mempunyai mutasi genetika yang tertentu. Jadi kita harus cek juga genetiknya gimana, macam-macam. Nanti biar dokter akan ngecek apakah keluarga ini mempunyai gen genetik yang membawa kanker. Dan kalau memang iya, maka seisi dari keluarganya itu harus dilakukan cek lebih awal untuk bisa mendeteksi kanker ini secara dini.
So I think maybe are they asking? It's a question about whether eating burnt food, like like char grilled food, dangerous. I mean, I think there's a lot of myths about that. Yeah, we eat burnt food, it will result in cancer. And I guess there is a worry that these burnt food could be what we call a carcinogen, right? Or cancer causing. But I think there's actually no real studies that have shown that if you eat burnt food, you will get cancer. The reason why there was this debate about it is because when food is burned, it produces a certain chemical that has been shown to sometimes be cancer causing. However, I don't think there's any real studies, but I think we probably shouldn't focus on how much burnt food we can eat, but really focus on eating more healthy foods and high fiber fruits and vegetables. Yeah.
Okay, but maybe Dr. Chris, maybe I just add up a bit of question. Sometimes a grill or a satay, in the corner there is a burn part. Do you think that a cancer?
The best part, yeah, the best part.
Yeah, the best part, right? So that's why I asked you.
I mean, I personally feel that just eating that bit of burn part is not going to cause you to have cancer.
Wow, yeah. That would put me a relief. That's just my,
but it
my favorite food.
That affects if eating a lot of these burnt foods means that you're eating a lot of fried and grilled and fatty food, because usually it's fatty that it gets burnt, right? Probably will lead you to have other, health concerns.
I see. Oke, jadi ada pertanyaan teman-teman sekolah, Bapak Ibu, bahwa apakah makanan yang dimasak dengan dibakar menggunakan arang itu menyebabkan kanker? Dijawab oleh Dr. Grace, sebenarnya tidak ada penelitian yang konkret yang menjelaskan bahwa setiap makanan yang dibakar menggunakan arang itu menyebabkan kanker. Ya, sebenarnya nggak apa-apa. Ya, jadi saya juga tanya juga, apakah makanan yang misalnya sate itu ujungnya ada yang kebakar itu dimakan kan enak? Apakah itu juga menyebabkan kanker kalau kita makan? Dr. Grace juga menerangkan sebenarnya tidak. Tetapi, ada tetapinya. Ini kalau kita konsumsi dalam jumlah besar ya, makan makanan bakar-bakaran, daging-dagingan secara berlebih. Sebenarnya kita nggak usah bingung ngurusin berapa banyak sih kita makan ini pada ini. Sebenarnya kita harus perhatikan saja diet kita itu. Jadi perbanyak aja makan sayur, makan buah, makan yang lain-lain itu lebih berguna dibanding kita ngurusin yang ini. Karena ini juga menyebabkan penyakit yang lain. Karena itu makanan memang tidak sehat. Karena makan banyak daging, banyak lain-lainnya. Jadi bagus kita memperbanyak makan sayur dan buah.
I think that, even in our own practice, we are actually seeing younger and younger patients with cancer. I think with regards to stomach cancers, I think that the genetics definitely has a lot to play in it, because when you look at the stomach cancer studies, you see that there are actually a lot of mutations that are involved in stomach cancers. And so, I think that a lot of the young stomach cancers is probably has some relation to a hereditary or family sort of passed down kind of a situation. I think also environmental is also a big thing, but there are so many factors that we cannot explain in that sense. So I think it is not, we don't really know, to be honest. I think that if you do have a stomach ache, I wouldn't say that you should worry that you have stomach cancers, but I think the important thing is to just be aware that of your symptoms, and when you have something, don't just brush it aside, but probably monitor. And if you're having these symptoms persistently, meaning like keep on having it every day, maybe once a week initially, then it becomes more often to twice a week or 3 times a week, and the severity of the symptoms are getting worse. It's affecting your sleep, it's affecting how you work, then these are the things that you should definitely seek help and check out on it.
Oke, jadi ini ada pertanyaan tadi, kenapa sih kok pasien itu semakin muda usianya ya? Jadi Dr. Grace menerangkan bahwa sebenarnya untuk menjawab pertanyaan itu sebenarnya agak susah ya, karena nggak bisa terjawab. Tapi diperkirakan oleh Dr. Grace adalah karena mungkin ada faktor keturunan ya, jadi keturunan ini dibawa dari dalam keluarganya, atau ada juga karena mutasi gen. Jadi memang banyak sekali terjadi mutasi gen, tapi memang tidak mudah untuk dijelaskan, dan memang ya tidak bisa dijelaskan, kemungkinan hanya turunan saja. Dan jadi yang membedakan antara sakit perut biasa dan sakit perut yang membawa ke kanker itu sebenarnya kita nggak perlu khawatir kalau sakit perut. Kebanyakan sakit perut itu nggak apa-apa. Ya cuma kalau yang harus diperhatikan adalah gejala-gejala lanjutannya. Jadi selama kita monitor itu, apakah sakit perut itu semakin parah atau bagaimana sakit perut ini mempengaruhi kehidupan kita sehari-hari. Kalau mempengaruhi kehidupan sehari-hari ya mungkin segera kita periksakan ke dokter. Gitu. Because times.
Terima kasih telah menyaksikan video ini. Dan jangan lewatkan video menarik lainnya dari channel Tkon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tkon TV.